Today our special guest is Dr. Kirk Eriksen. He is a chiropractor, but his technique and his mode of operation is a little different from other modalities of treatment. In fact, Dr. Eriksen, I understand that your particular type of chiropractic care was featured on the Montel Williams show recently. He has a rare disease, and that has alleviated a lot of pain. Tell us about it.
Yes, Montel Williams was referred to a friend of mine up in New York who performs the same type of chiropractic procedure that I do, and he was able to get some amazing results. So he had his doctor featured on one of his television shows earlier this year.
And of course, we have permission to use that. Let's take a look at that clip, and then we'll talk about it.
I'm not certain, because I haven't done the scientific research on it to know if this can work for everybody else out there. But I'm going to tell you, I suffer from MS. I have extreme neurologic pain in my lower extremities. I'm in pain 24 hours a day, 7 days a week, 365 days a year. And then I go to see this doctor. I've had pain in my feet. I've struggled with my balance. So Dr. Eriksen sent me to see a man who I will tell you now 12 days ago. And there's not a person who knows me who will not confirm this if you just ask him. Everybody who sees me, I am walking differently. My pain is less. I have already regained strength in my left leg. My left leg has dropped because I found out that my pelvis was tilted. It's dropped back down. They are now the same length. It's the most amazing thing that's ever happened to me. Take a look at this.
Now, he goes on to say that because how can one simple procedure in your neck radically affect the rest of your body?
Well, you know, you first have to start and look at the anatomy of the area. The upper cervical spine, which is the area that Montel had adjusted, the shape of the vertebrae are very unique. This area has a very important job because it has to support basically the weight of the head, and it has to enable for a large degree of range of motion in this area, but yet it has to be able to protect the delicate blood vessels and the nervous system in this region. So what happens is through traumas and accidents, things that can cause this area to misalign, that's when it creates a problem. Now, here's one thing I think we should keep in mind about this area is that there are various connections of the bones in the base of the head and the bones in the upper neck to the spinal cord. Now, in 1995, there was a discovery where they found a little muscle in the upper neck that was literally connected to the upper cervical spinal cord. Dr. Gary Hack was the one that discovered this. This was never known until 1995. I was lecturing at a research conference a couple years after that, and I got to meet him and actually went through dissection studies with him where he personally demonstrated and showed me this connection. Because there's a covering around the spinal cord called the dura mater. And we know that there's a connection between the spinal cord and the dura mater, but now with these other findings, we're finding out there's a connection between this outer covering and the bones of this area. For instance, this slide here shows these epidural attachments that connect the bone directly to the dura mater. So suffice it to say, what happens is at the base of the skull, the skull and the upper cervical vertebrae have to be connected to the cord, because when you bend your neck forward, you're stretching this area. And what would happen is if it wasn't connected, you would pull your brainstem through this hole here, and that can't happen.
No.
So God, in His infinite wisdom, creates us in such a way that this is anchored here to prevent that from occurring. But now we've got a very vulnerable area, because if something is misaligned in this region, it doesn't necessarily pinch anything, but it creates stress on the nerves around the spinal cord at the base of the skull. So it's a very unique area.
Well, knowing Montel Williams, he would not go on national television and say if people watched him the way he walks and everything. Now you have, the thing about it, your procedure is so simple. You have to, of course, check, and there are ways to check, but it doesn't hurt. It's not popping a neck or anything like that.
Sure.
So let's say, I think we have another visual on this to show maybe about the alignment of the spine and so forth. And that's what we're looking at here.
These are a couple of patients from this week here, and you can see what we're doing is we check their posture standing up and we check their posture laying down. Here, as this patient is laying down, you can see it looks like the one leg is over an inch shorter than the other, and on the other one, after the adjustment, it's almost balanced. And the important thing to keep in mind here is that this was performed from an adjustment to the neck. Now, again, unless you understand the neuroanatomy of the area, it may be hard to understand how this works from an adjustment that is barely felt. But
yeah, my husband thought, you're not even, he didn't do anything. And I said, yes, he did.
It doesn't take much force to move it if you've come up with, use mathematics and geometry to figure out from the x-rays exactly how to correct somebody. One thing I want to say clearly is that chiropractic care is not a treatment for multiple sclerosis, which is what Montel has.
Yes.
Or any other disease or disorder for that matter. But chiropractic care is a system of assessing the spine to find out stress on the spine and the nervous system and correcting that stress. Since the nervous system controls and coordinates all the functions of the body, removing that stress may have very profound effects throughout the body. And
of course, he has written 2 books. He's had some help on these. I can't get over how much this man knows about our body and the way it functions. The first book, tell us what it shows.
Well, the first book was a review of the medical and chiropractic literature on the cervical spine. But I guess if we just look at the visuals here of the 2 books here, the first book shows the connection between the alignment of the head and neck and how it affects the alignment of the entire spine, as you see on the other book here. You know, I had a patient fly in from Europe a couple years ago who had multiple sclerosis and a series of other problems that was in a wheelchair, and we filmed her entire care, and we filmed her going from a wheelchair to a walker to a cane. And again, I was not treating her MS or treating anything else. I was correcting her spine, taking the stress off her nervous system, and allowing her body to express the most optimal health that she could.
And of course, our body was designed by God to heal itself.
Absolutely.
And so that can... Dr. Eriksen, thank you so much. Locally, you can give him a call if you're interested in this procedure. It works wonderful with people that have seen remarkable results. Very simple treatments over a period of time. The number to call here is 334-793-7992. Our special guest, Dr. Kirk Eriksen.